Hey, it's Jocelyn from the Vagina Doc Physical Therapy and Wellness. And if you're watching this video, you've probably subscribed to receiving my 7 postpartum secrets, postpartum body secrets, and becoming a mom machine. You've learned so welcome to this video where I am going to teach you about some basic anatomy of your perineum, of your pelvic floor, so that you can start taking a look at yourself. So the reason why I think this is so important is because in order to achieve some of the goals that you may have with your pelvic floor physical therapist, we've got to create a positive brain map if you don't already have one, which for me, if you've read my personal story, which included a history of complete avoidance of anything that had to do with sex because it was painful, I totally dissociated myself from that area of my body. So to know how to contract and relax it, that was a big challenge. And I didn't really go into that in that email, but that is some of the conversations that I have with my patients. Let's say, hey, I want you to be able to contract on command and then relax on command. But if you are totally associated with that area of your body, it's going to be really hard to utilize that area given how hidden it is. So that's what I'm going to dive into next. I'm going to go over some of the basic anatomy on a 3D pelvic model. Then I'm going to point out that anatomy on a 2-dimensional model that I have on here that I'll share my screen with you so you can see. And then I'm going to walk through some things that I would like you to do in your own time to see if you can identify some of these live structures on yourself and essentially test the function or the basic function. So let's dive right into it. And I'm going to start off with just give you a brief overview. So your pelvic floor, as I typically describe it to my patients, it's the foundation of your house. Your pelvic floor works with other components of the house to keep your body functioning optimally. So keep things out of the house, keep things in the house, keep all the processes going in and out pretty smooth. So your pelvic floor itself is divided into 3 different layers. So let me start by going into what the function and then the anatomy of layer 1 is. So layer 1's main function is sexual function. There is a support function, meaning that there's aspects of the anatomy here that holds the front and back door together, that stabilize the vaginal walls, and also houses really important organs that keep your vagina lubricated or keep your anus functioning optimally. So let me just stick with the basics because this stuff can get kind of confusing. So what you see here is what I would see if I were looking on the outside minus the skin. So the pink tissue is the red tissue is mostly muscle tissue. Let's start off from the top. So right here is called the clitoral hood or the clitoral hood, and that hides the underlying clitoris, which is the only organ that is strictly dedicated to sexual arousal or sexual pleasure in women. So the clitoris looks small here, but it's actually a lot bigger as it extends deep into the pelvis by kind of like arms on each side. So a lot bigger than what you see here. Let's go down, and it's hard to see, but right here there is a hole, and that is the urethral meatus or the urethra, and that's where urine exits in women. Below here is the bigger hole, and that is the vaginal opening. If we go below here, you see a thickening of tissue. That is the perineal body, and that is an area of convergence of many of the muscles what you see on the outside, in addition to some of the deeper muscles. This then extends into a circular muscle called the external anal sphincter. So when I say the front door, I'm referring to the vaginal opening. When I say the back door, I'm referring to the anal canal. So going back up, and this is a removable piece, and it's one that doesn't necessarily, it does stick pretty well. Going back to the muscles on the top, right here is a muscle called the ischiocavernosus. And that muscle, when it contracts, holds the clitoris erect or up. So its muscle, or its function, is primarily sexual function. Alongside here, it's not the easiest to tell in this video, and here it's missing, so you can see an underlying gland. It's called the bulbocavernosus muscle. In men, it can be referred to as the bulbospongiosus. And that muscle helps stabilize the vagina in addition to keeping the clitoris erect during sexual arousal. So what you see here, this other colored tissue, could be, so the limitation of this model is it doesn't show the outer skin. So you have over top here, if you were looking at yourself, you have the labia majora where hair actually grows. And then if you move that out of the way a little bit, on the inside of that is the labia minora, and hair doesn't grow there. So right here, or the vaginal opening, is referred to the introitus, and the tissue that delineates the inside of the vagina and outside the vagina is the hymenal remnant, so the hymenal plane. And that's an important landmark for myself and other specialists such as gynecologists, urogynecologists, to look at vaginal wall support. Okay, so now I'm going to go to another muscle, and the layer 1. And what you see here, this muscle attaches to the sit bone on your right and left side, is your superficial transverse perineum muscle. That muscle is on your right side as well as your left side, and that helps stabilize the perineal body here. Let's see. So what you see here are glands that can become inflamed, and when they're inflamed, typically you shouldn't see them, and when you do, it's typically because there's an inflammatory process that's happening. So as a review, layer 1 primarily function to support sexual function. Now, other things I would like you to, what I look at is color of the tissue. So in general, you want to have a uniform color. Some people, or we all have different skin tones, and depending on your skin tone, the color may change. So it's hard to compare person to person. So I don't recommend comparing yourself to your friends if they have different skin tones. But in general, you want to take a look at, does this look healthy? Does it look like I've been rubbing the crap out of this area? Does it look like I'm itching this area? The other thing I check for is overall dryness. Does the tissue look really dry or atrophied, meaning the muscles are weak? Does it look like, is there any white spots or any textures that shouldn't be there? Is there discharge? And if there is discharge, what color is it, and does it have a smell? All those things give me insight on whether or not your problem could be something that is out of my hands, meaning you need to see a physician, they need to get you certain medications, or is it an indication that maybe your hormones are off, or your diet is impacting your the mucosal skin of the vaginal tissues. So you basically take a look, and it either looks uniform, if it's pinkish or a shade of pink that doesn't look irritated, that's good. If it looks pale, dry, that's generally an indicator that you may want to see someone for that. Okay, so that's layer 1. Layer 1, if I'm examining the tissues, is on the outside, so I can test these on the outside, but it's also within 1 knuckle of my, if I'm doing an internal exam. So layer 2 then is a little bit deeper and about 2 knuckles deep if I'm doing an internal exam, and I would have to get the best idea, I do an internal exam to test this area. Layer 2 is not well delineated here because it's so close to layer 1, and this is somewhat of a cheap model. So basically this model serves as the main sphincter function, meaning, so a sphincter is an area that is typically consists of circular muscles that close off an area, so things that shouldn't leave, meaning so you don't pee yourself, so you don't poop yourself. You have the external anal sphincter and the internal anal sphincter in the back here, and so that's kind of layer 1, layer 2-ish. And then at the front door, you have 3 muscles that close off the urethra, compress the urethra, and then also encircle the vaginal opening and the urethra to provide a little bit more support. And those, so that you don't pee yourself, so that you get a little bit more squeeze pressure through your vagina. So this is the sphincter urethra, the compressor urethra or urethrae, and the sphincter uretrovaginalis. So layer 2, this helps aid in preventing loss of urine. In addition, in the back door, EAS, IAS, preventing loss of stool or gas. The other thing that's in layer 2 is called the perineal membrane. So think of this is a non-muscular area, but one may argue that there's a lot of continuity there, but think of it as a trampoline to aid as a reinforcement for your organs above. So it's not muscular, but it's reinforcement to provide support for the organs above, in addition to connecting all the areas of the pelvic floor to function uniformly. So often layer 2 is injured in some capacity during an episiotomy. Same with layer 1, or substantial tearing. So if you're testing yourself, 2 fingers deep, and before I forget, the last muscle I want to talk about is the deep transverse perineum, and that's just underneath the superficial. So layer 3 then, I'm going to remove this, is the deepest layer, and when I'm doing an internal exam, it is a full finger deep, and sometimes even further. And this is where the part of your core, the foundation of the house, truly sits. This is from a top view. This is a bottom view. What you see here is called the levator ani. So the levator ani is separated into individual muscle fibers that all kind of have a somewhat different role. So you have certain muscles that help with keeping if you squeeze, maintaining a strong squeeze pressure. So if you were to test yourself, you would feel a tight squeeze around your finger. Or if you were to squeeze during intercourse, your partner would be able to give you feedback on whether or not they may feel a tightening or not. So then there's other muscles that aid in actually lifting up the organs that sit above higher, so they're not putting as much pressure down on the muscle tissue. And then you have other muscles that are not technically considered part of the pelvic floor, but also attached to the tailbone and the hip and provide either a direct support to the pelvic floor or other areas of the body. So these muscles can be tested from the outside. If I sink my fingers just inside of your sit bones and have you do a contraction of pelvic floor contraction. So now I want to share with you some of the two-dimensional model. So let me bring that up. And I share my desktop now. It's my first time, so it's not what I'm looking for. Here we go. Looking for what you would see on the outside. So right here, this is a picture that kind of shows you all of what the nerves tell your brain. Like if a nerve's affected, where are you experiencing it? So I'm going to show you a couple different pictures. So right here, you see the labia majora. Inside of here, you're going to see the labia minora. Here you have the clitoral hood, and the clitoris sits just underneath right here. This would be where the hymenal plane is, and if we spread tissue, you'd be able to see the inside of the vagina if you spread enough. Right here would be bulbocavernosus. So if this is the pubic bone here, and this is the part of the superior pubic rami, this is the pubic rami. Underneath here is going to be where the ischiocavernosus is. So for me, I just kind of get underneath the bone, and that could be either over close or internally. This is the perineal body, and then to the right and to the left of this would be your superficial transverse perineum, and this would be the anus and the external anal sphincter. So if I get out of this picture and show you the other picture, so it's really fun whenever I use these, print these pictures at work, and then the front office gets these pictures, and it's like, surprise. Where are you? Here we go. Okay, so a less busy slide or picture here. This is the clitoral hood, underlying clitoris. Can't really see the urethra in here. This is the hymenal plane, or the introitus, labia minora, labia majora, perineal body, backdoor, or EAS, anus. This would be the ischiocavernosus, bulbocavernosus. And as you can see with the tissues, it's symmetric. There's a pinky tone. It looks healthy. And then again, here's a different picture. Here you see a better picture of the urethra. You see the labia majora, and then you see the labia minora, or inner labia, outer labia, clitoris, clitoral hood, anus. This is the spot between the entrance of the vagina and the anus, the perineum here. And then it doesn't necessarily show the specific muscles. So for the deep layer now, that's a male. Males are important too. Go back here. This is a pretty good picture. Okay, so this would be me looking from the underside if you were standing up. So what you can see here, if this is the pubic bone, this is the ischiocavernosus, this would be your superficial transverse perineum, this would be the bulbospongiosus or cavernosus. It just depends on what resource you're looking at. External anal sphincter, Then you have the underlying levator ani, and certain portions are called certain things. So an inner portion that slings around your rectum to keep you from pooping yourself is the puborectalis, and just inside of that is called the pubococcygeus. The pubococcygeus, along with this muscle here, the iliococcygeus, helps provide that lift, whereas the puborectalis helps provide the squeeze pressure. Back here is your coccygeus, or your tail wagger. That is not part of the pelvic floor, but it functions similarly in that it attaches to the tailbone. This is your piriformis. The sciatic nerve runs underneath the piriformis and sometimes through. This is the obturator internus, that is a very important stabilizer for the pelvic floor and the hip. As you can see, it attaches to this bone here, which is your hip. Okay, now, this is the part where I want you to come back to or use while you look at your bits. I don't expect you, I'm not gonna walk you through how to check your inner pelvic floor muscles, but I am going to introduce you to looking what's on the outside. So find a private space, and you're either laying down or you're standing up with one of your legs elevated. And I would like you to have a mirror so you can see. Let me get here. See if I can go full screen. Such a noob. Okay, here we go. So use a mirror so you can see. So what you're gonna do is identify each of those pieces. What I want you to look for is your urethra, if you can, your vaginal opening, your anus, your clitoris or the clitoral hood, and then you're gonna feel a bony portion of your body. And I want you to come just underneath there, be gentle. There you'll find your ischiocavernosus. It's hard to feel. So if you just so you have a general idea where it is. And then the space between front and back doors, you have your perineal body. And then if you can feel your sit bones, so sometimes that might be helpful just to sit and then find them. And then slide over towards the perineal body on both sides. That's going to be your superficial transverse perineum. Take a look at the tissues. Do they look symmetric? Do they look like there's a uniform color? Does it look dry? Does it look like there is colors that shouldn't necessarily be there? What I will say is I use a headlamp, and that really helps. So if you can't see, you may need a better light. Now, what I want you to do is I want you to squeeze your muscles as if you were stopping the flow of urine, and see if you see this pull in this portion and this portion, tighten and pull away from what you're looking at. You should always also be looking for if you see a wink there. So as you squeeze, this area should contract a little bit, and that kind of looks like a wink. Now what I want you to do is I want you to put your hands lightly on the sides of the vaginal opening, over top your labia majora, or right here, and I want you to tighten again, and make sure you're gentle and see if you feel a contraction. You should feel a contraction. If you're pressing too hard, you might be pressing through the contraction. Now I want you to take a look, and I want you to cough. Do you see, does this area move towards you? And if so, how far? Do you see a contraction right before the cough? And I don't expect you to because it's very quick. So instead, I want you to contract first and then cough. And you should see, you might see a little less descent towards you, maybe not. Now I want you to push as if you were having a bowel movement. What happens? Do you see any tissues here come towards you? And if so, how far? Now what I want you to do is pay attention to how you're pushing. Are you straining? Are you, see how my face, you can't see, but it would be getting red and my veins are popping out. My belly is moving inward. What should happen is I am exhaling and my belly is expanding outward. So it looks like this. From the side. And it doesn't have to be blowing like that. It could be like shh. It could be anything, but as long as you are letting air out, allowing your belly to expand. Does that change what you see here? It should. So what I typically see is when people strain and I already see tissue moving downward is when I teach them a better way, it's less. So there's less strain to the pelvic floor tissues, less strain to the vaginal walls, less descent of the organs. Now, those are the main things I want you to check for now. What do you find is, do you have pain? Are you seeing something that you're unsure of? Are you seeing that contraction? Are you not? Now go ahead and practice this and then maybe revisit, and then is it any better? Now I've told you about prolapse. I've given you some basics of the anatomy. At the end of this 7-day series, I'm going to give you an opportunity to register for a webinar. This webinar is going to teach you 3 key things of really starting to take care of your postpartum body so that you can become stronger before pre-baby. You can start hitting those PRs that you've wanted, but you've hit a plateau, or you can confidently get back to an exercise program knowing that you have control of your body, and if you don't, you have the resources of how to get control. This isn't going to take away your visit with a pelvic floor physical therapist. It is just to optimize or make the process much more efficient, because the first 4 visits is me teaching you how to contract certain areas and not contract other areas and coordinate areas. It's a lot more than one would typically associate pelvic floor physical therapy with. I hope you enjoyed this video or you got something out of it. I will admit, the first time I've taken the pelvic floor series to be able to treat this twice through, and then I've also got a good chunk during my formal DPT education when I was getting my doctorate, and then I've been treating this for a while now. And it's now that I feel very confident, but initially I was like, what the hell am I looking at? So if you don't know what you're looking at, that's okay. Now you have a resource that you can trust. At least what I put out is something to guide you. But again, it doesn't take the place of medical advice, diagnosis, or treatment. So go see your medical provider and get things rolling there. Thanks for watching. If you have any questions, type these in the comments or reach out to me on Facebook, either the pelvic floor support group for female athletes and active women, my Instagram account at the.vaginadoc, or by replying directly to an email. Hope you guys enjoyed this. I'll catch you on day 5. And day 5 is going to be all about diastasis recti.